In this video, I'm going to discuss a test called the Galleri test that can provide early detection of more than 50 types of cancer. The Galleri test is intended for people aged 50 or older or adults with an elevated risk for cancer. First, I would like to explain how the Galleri test works. All cells, both cancer and non-cancer cells, shed cell-free DNAs into the bloodstream. Certain DNA methylation patterns signal the presence of cancer and helps pinpoint the origin of the cancer. DNA methylation is a chemical process used by cells to regulate gene expression. The methylation patterns of cell-free DNAs can be analyzed by the Galleri test, which can detect the presence of more than 50 types of cancer and identify their origins. The Galleri test needs to be ordered by a physician. The test requires 2 tubes of blood. The Galleri test is not yet approved by the FDA. It is not covered by insurance. The out-of-pocket cost of the Galleri test is $949. If a test result shows cancer signal detected, then further diagnostic evaluation is required for cancer confirmation. The Galleri test is not recommended for people who are pregnant, 21 years old or younger, or undergoing active cancer treatment. Before you decide to have a Galleri test, you need to determine if it is an effective cancer screening test for you. An effective cancer screening test can detect cancer early and decrease the risk of death from the cancers being screened. The benefits of an effective cancer screening outweigh its harms. The potential harms from cancer screening tests are due to false positive results, false negative results, and overdiagnosis, which is a diagnosis of cancers that would not have caused medical problems and did not need treatment. False positive results can lead to patients' anxiety, additional testing, and/or unnecessary diagnostic procedures. False negative results provide false reassurance and can cause delayed cancer diagnosis. Overdiagnosis can lead to unnecessary treatments that are harmful to the patients. While the Galleri test can detect cancer early, it is not clear whether the early detection will lead to decreased risk of death from the cancers. Before you take the test, you should have a thorough discussion with your physician on how the test can benefit you as an individual. In contrast to the Galleri test, which has not been approved by the FDA, the following cancer screening tests have been approved and recommended. Most insurance plans cover the cost of these screening tests. Colonoscopy, sigmoidoscopy, and stool tests are commonly used for colon cancer screening in adults aged 45 to 75 years. Screening mammography is recommended as a biannual breast cancer screening test for women aged 50 to 74 years. Women between 40 and 49 years of age may elect to have biannual breast cancer screening. Low-dose CT is recommended for annual lung cancer screening in adults aged 50 to 80 years if they have a 20-pack-year smoking history. Pap test and HPV testing are recommended for cervical cancer screening in women aged 21 to 65 years. Whether a Pap test or an HPV testing should be used is determined by the age of a woman. Thank you for watching.